Okay, let's call the meeting to order. Sophie, roll call?
Graig.
Yes.
Maggie is excused. Rosemary
Here.
and Max.
Here.
Okay, will you please stand and join me with the salute to our flag? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you very much. Rosemary, would you read them into the district's mission statement, please?
Our mission is to anticipate and provide services to meet the healthcare needs of the people we serve.
Thank you very much. Welcome. We're having a new way of doing this thing. We have a consent agenda. You can pull anything from the consent agenda if you want, or we can just take a motion to accept the consent agenda as presented. So whatever your druthers are.
We have one now?
Yeah, let's look at the agenda. This consent agenda.
All it means is because now we have the finance committee, so we have to acknowledge both of them. Not only our original minutes, but also the finance committee minutes.
So you can just make a motion to accept the consent agenda, no discussion, it's over. Or you can pull an item, pass the consent agenda, and then there's discussion on the,
No.
on whichever item you pull.
So the consent agenda really is only the minutes from the.
Yeah, that's right.
minutes.
That's-
You're just approving.
Okay, because when I was on the other board, there used to be a lot of things on the consent
Yeah.
agenda.
Yeah, we only have
So,
those
well,
two
two
items.
is enough, yeah.
Okay, so either I'll entertain a motion to approve the consent agenda, or if someone wants to pull an item, to pull it, then that can be open for discussion. What are your druthers?
I have a couple questions about the finance committee meeting I wasn't at. If you want to talk about that as a separate issue, but approve the minutes, or
Yeah, we can talk, maybe treasurer's report?
as long as I can ask questions about that, I don't have a problem approving the minutes.
Okay, so do I have a motion to approve the consent agenda?
I move we accept the consent agenda.
Okay, do I have a second?
I'll second.
Okay, and seconds. Roll call?
Graig,
Yes?
Rosemary
Yes?
and
Yes.
Max.
Okay.
Yes.
Public comment. Members of the public are welcome to participate in the meetings of the board. Comments of the public will be accepted during the public comment portion of the agenda. No comments, no actions or comments will be taken by the board on matters not on the agenda. Public comments on agenda items should be made at the time each item is considered. When the board president recognizes a member of the public for oral comment, such comments shall be 3 minutes or less at the discretion of the board president. We would like a calm presentation so that the importance of what you're presenting is not overshadowed by the manner of your presentation. I don't see any public comment, so with that, we'll go on to the communication coordinator, Adriana.
Hello, everyone. Let me just pull up my notes over here. This month, Ida and I attended the Girls Inc. Women's Luncheon, and we actually were sponsors of that, so they included us in their messaging as well as their program. And it was very nice. It was a very nice event that we got to attend and hear women from 3 counties tell their story about success and women empowerment. I also attended the Salinas Chamber of Commerce annual awards, where 2 of our partners were actually honored. Esmeralda Owen from Precious Stone PR, and also Alex Garcia from Mag One. As well as this month we were able to host a baby shower for one of our district employees. Rodrigo, one of our maintenance from our maintenance crew, and he was supported by everybody in the district, all facilities. So all of the clinic staff came out during their lunch, and also Eden Valley members came out during their lunch. And it was celebrated here at Rosie's Garden, so it was very, very beautiful the way that all staff came together to commemorate that.
And it's his first little one, so all the newness, yes.
So for men as well as women, that's great.
We
That's
yes,
all right.
we have them for all.
Yes, we are
Nice.
very inclusive here. And I would like to share that Mama Kitty, our long-standing pet, has unfortunately passed, and we
Oh,
did a commemorative post on social media for her, and she got a lot of comments.
She was a love, I mean, she was here before I got here, so they estimate she was here 18 years living on the property as our cat, and she was loved by our residents, loved by our community, by our staff. Our staff was really devastated, you know, because it's just like any pet, they become part of the family.
sure.
We've recently she just recently passed away, so, yeah.
And I was also honored to attend Pauline's bench ceremony. Last week, she got honored by with a bench at the Family Resource Center, and that was put on by Rotary and also the Soledad Unified School District. And it was great to see the community come together for Pauline. And then we also, in your packets, I attached a couple papers here. We celebrated Jay Richards' anniversary, who is our occupational therapy assistant. In the last page, I created this Facebook testimonial that says how we celebrated Jay with a social media post. I gave him a certificate as long as a 1-year anniversary pin, and he said we made his day with that touch. And then we have some comments on Facebook here, so you can read them at your own during your own time. But pretty much just saying how great of a job he does here for our residents, and a testament to that. And I also highlighted Josie, the new DON at Eden Valley, on social media. She also got a few warm welcomes on social media comments. And then while we're talking about social media, I am working on promoting the Athena patient app for the clinic. That way we can have a little bit more autonomy on the patient, having autonomy on their health and their records and all of that. And this packet, you will also find a very lovely note that Pamela, our social services, gave me, because she wanted to make sure that we were aware of what wonderful, of the families that are so thankful for our staff and everything that they do. And also, Eden Valley admissions team went out to the Soledad Senior Apartments to do a informative presentation for those people who are at the senior apartments here in Soledad.
How many people attended?
There was probably about 7 to 10 folks, and so it was admissions clerk Erica, the administrator Susan, and myself. And it was in one of their they have like a little community room, and so we sat there, and a majority of them either have visited or have had residence here or been residents themselves. So they were really happy to have us out there and here. So that's and if you guys remember, that was gonna be our motto this year, is to go out and touch our community in different ways, and this is the way that we're touching our community.
So there were seven
Residents
residents. And
from the seniors.
Okay.
Mhm.
So is that the ones by the swimming pool?
It is.
Yeah.
Okay.
Yeah, so they had, it was a full day round robin of partners coming in. So Alliance on Aging was gonna come in right after us.
Oh, nice.
Yeah, so they have this I guess monthly or regularly or quarterly, and so they invited us to participate.
Well, that's good.
Yeah, we did it last year as well.
It's good to get out there.
Yeah.
You know what, I was shocked, just me personally, at the resource center when they dedicated Pauline's bench, the people who work at the resource center spoke because a Rotary meeting followed. You could go right to that resource center on Main Street and get whatever you need. If you need food for the day, if you need clothes for the day, for a new jacket, if you need psychological counseling, I mean, there's a list this long of resources that you could get right here in Soledad. You don't have to, if you have problems, you don't have to travel to get them solved. I was shocked.
And that, Rosemary brings up a good thing. That's a good place to, I don't want to use the word advertise, but put the word out of Soledad Healthcare District, clinic.
Yes, actually,
Because the clinic visits are down. That's a good spot to put it, only so that, it's just, and it's more that visualization, it just reminds people that this is a spot. But it might be something to look into just to, I don't know.
yes, we did have a little roundtable discussion where I did remind everybody that we have a walk-in hour every day.
She did, yeah, she did.
Oh, at the resource center?
At our meeting. The meeting.
But I mean, if they put up posters or something that just,
Advertise our services there?
I can talk to
That's a good idea,
Artemisa.
yeah.
I can talk to Artemisa and see what we can
school
do.
visits or,
Well, right now, for example, we're supporting the school district with their T-DAP.
With
So
the what?
It's a three, I think I mentioned it last month, it's like 3 vaccines in one
Oh,
that
yeah.
children entering the 7th grade are required to get. So we're supporting the school district with that. So yeah, just letting
it
people
would
know.
just be a good reminder
Yeah,
for,
that's okay.
vaccinations, back to school checkups, whatever.
Yeah, one of their biggest partners is actually the mobile clinic
From,
from Simmons
SVMH.
Valley Health.
all the more reason to put your name higher on the list.
Yeah.
And that's, put it out there, because it'll get overshadowed if you don't.
You beat a mobile clinic by having a little small clinic room right there. You already
I
have
offered
this.
that to them.
It's hard to get, but that would beat a mobile
I-
clinic because you're there.
I told Randy, let me
That's
set
not a
up,
bad
because they
idea.
have like a little conference room. I says, let me set up a clinic there and we can, work. Because other school districts, they actually have medical clinics in the school
facility.
districts.
Oh, wow.
And it's already happening outside, and I thought, let's be creative,
Yeah.
but
Especially because schools don't really have school nurses anymore. There's a school nurse for the district often, and then it's a health aide
Yeah.
that, not quite a full nurse that's doing the stuff at the school. So that would boost up the schools because nurses are too expensive. So they have a nurse and then they have health aides at all the schools.
That'd be a good idea, just to keep it out there.
Yeah.
It would be
And
a
provide
good- it
service,
would be
and
a
then the kids
good
get better
thing,
care.
you
And then they're connected.
That concludes my report. Thank you.
Any questions? Thank you very much.
Thank you.
Okay, treasurer's report. And Max, what we'll do is we'll have you do the treasurer's report and then we'll have
Yep.
questions. Does that sound like a plan?
That's fine.
Okay.
Okay. March, we're looking at the closing of March, which is for the 9-month period. We start on page 10. Looks like Craig's already got it circled down at the bottom of the page. Okay, we are at 114 days of cash on hand. Now you have to realize that we received a loan of 1.1 million. Okay, which we haven't used to pay down the debt yet. So it was just
That'll-
sitting there,
yeah.
making us look real good. for March.
Understood.
So that 1.1 million represents about 30 days. So we're really at about 84 days,
That's
which
better
is
than-
still an
good.
improvement
Yeah.
from where we have been. But we have 4.2 million. Once again, 1.1 million of that is the new loan that we have that will be used to pay down one of the PPS settlements. But it was a good month as far as revenues, and it was a good month as far as collection as well. Okay, and we're going to see that. So our accounts receivable you'll notice is 1.9 million versus 1.7 million the year before. You know, we've been averaging about 400,000 to 500,000 higher than the year before, and so that tells me that we did a really good. We were able to receive the money that has been owed to us, a good chunk of it, okay, during the month of March. The other thing there is down below, you can see our total debt. You look at your total liabilities, they're at 10,000,006. That's because we haven't used that 1.1 million to pay down that debt. Okay? And PPS settlement, you know, in years past, we have booked that as of June 30th. I've told you multiple times now that as of December, I booked 6 months of the current year of PPS settlement, and as of March, I booked another 1 quarter. So right now we have booked, it was 750 plus 375. So we've booked 1,125,000 of the PPS liability for the current year. So that's built into this, okay? So of that 4.8 million estimated third-party settlements, which is in your liabilities section, 1.125 is the current year, and we've never done that at this stage before. Okay, so but our revenues support it, so it's nice to have it in there. Okay, so turning to page 11, we'll look at our bottom line here. First of all, our medical services, we are 1.5 million higher than last year, and our contractual adjustments are 1.4 million lower than last year. Okay, and then that third line, that's where you can see the 1,125,000 that I've written off. Okay? So our total revenues for the 9-month period this year compared to last year is $1.9 million higher. Okay? Now, with all those additional revenues, there are additional expenses, and so if you look at our expenses are up 900,000. So our operating income is $1 million, $1,056,000 higher than the prior year for 9 months.
Good.
Okay, and that is with 9 months of the PPS settlement booked, whereas last year none of the 9 months had been booked at this point. Okay, so it really is positive in comparison to the prior year. Okay, bottom line, increase, decrease in net assets, 408,000 to the positive. Okay, you can see summary of income by operation, Eden Valley. You know, I looked at our census when I first got here. It was 51 for the month of March. Okay, that's why we have $1,772,000 in revenues for Eden Valley. It was because that census is
It's
up
full.
It's been in the high 40s, low 50s for several months now, so it's good. The Clinic and Women's Health Center is showing a $705,000 loss, but that's with the 1,125,000. Okay, so you take that away to be comparable to other years, you know, and we're, what is that? 400,000
to the
profit,
good. Yeah.
right? Whereas last year without it, we were at a $205,000 loss. So
Well,
we're
and-
600,000 better, you know, without PPS even.
And
for
you
the
know, I
clinic.
was looking through this, and it's about a $50,000 profit, or to the good, that the clinic is averaging per month, and that would be the 400,000 that you
Yeah.
see to the good in 9 months. Here we are now.
Yeah.
Yeah.
So it's about 50,000 that we see to the good. If we didn't have that darn,
We're almost there, Ann.
We're getting there.
We're getting there.
I think we should have a party when we get that.
I think
done.
so too.
Nobody will understand it, but it'll be a reason for a
PPS
party.
what?
PPS burning, yeah.
Yeah.
PPS party, yeah.
Burning,
Burning, yes.
burning the mortgage, burning the PPS.
Okay,
When
on
are we gonna
page-
be done with that altogether?
2026.
Oh,
Well, we're at 24, because we're ending at 24, so it takes 2 years. Yeah,
Yeah.
2.5 years. So it'll be a little bit.
Okay, so our page 12, where we have our cash, you can see first capital has 2.7 million. That's where the 1.1 million sits.
Oh.
Right.
Okay. Our mechanics bank has almost $1.5 million in it, which is good. Our accounts receivable, clinic is 343,000, and Eden Valley is 1.6 million. Okay.
is this for month then?
That's as of March 31st, that's what people owed us.
January 1st
Or
through
through that, oh, I think it goes all the way back.
Through
That is
through
as of
July
March
1st.
31st, that's what people owe us.
Okay.
That's what hasn't
How
been
many of
paid.
those are 30, 60, 90 days?
We have a good turn. I think we're averaging 20, 30 days. I don't think.
Yeah, so
Pretty
we
much.
collected about 750,000 in the
Yeah.
month of March. So
People are pretty current then
Yeah.
with Eden Valley.
Yeah.
Eden Valley's been a little slower this year, and I think it's just because, we have more income and, the bigger checks that people have to cut.
Because
But-
it's coming from the state and Medicare, really.
Yeah, so we got big checks for Medi-Cal this past month, and so Medicare is still a little bit behind.
And the clinic, 30, 60, 90, that might be slower, huh? Patients slow.
I've got
I
that.
think I think they're around the same. They're not averaging.
Because for a while there, back in the day, Gary had designated 2 or 3 individuals to go out and try to collect. Remember that?
Yeah.
So the total amount that's receivable, this was without before the contractual adjustments. So we have 762,000 that's before the allowance for contractual adjustments. And less than 30 is 500,000 of it,
Oh, okay.
okay? And 31 to 60 days is 172, and then 63,000 is over 60 days.
I
So
wanted,
there's really not that much.
Not
out
too
there.
much, yeah. So that's good.
And they're aware when we meet. That's what we're talking about.
Okay, good.
Yeah.
has our now we mail our bill away, it goes away somewhere. Has that made much of a difference to us?
Your what?
When we pay the bill at the clinic, like personal, if I go to the doctor,
Oh,
when I mail my bill, it goes
To Bell.
somewhere
Mhm.
else.
Athena has its own lockbox, is what it's called, and they process all of our payments. I think it's only made a difference operationally, where we don't have to handle each one of the statements and wait for somebody to process it and do all that. They collect it, it goes through their system, and it's quicker turnaround.
Okay.
It should add less than a week to that because they get it and they post it electronically right
It's
away.
all- Yeah, it's a big operation, so they're just, and if you guys have ever seen one of these, you can Google it, but it's like these big machines, and they actually cut the envelope, and it just go. So,
wow.
yeah, that's what we choose, because otherwise you would have to hire people here to handle all of that internally. I mean, we do get on our
Well, even
occasion.
the tax collector now mails your property taxes go down to somewhere else. They're all,
It's all lock boxes
all
now,
lockbox.
processing.
Yeah, if you look at your property tax bill, it doesn't,
We just paid them.
and
I
it
know,
went
it just
that
went
way, it
four of
went
them,
down to
yeah.
LA, yeah.
Okay,
Okay, and then summary of income by month, middle of the page on 12, you can see the month of March, 313,000. Okay, so it was a good month. It's back up to where it was, July through November, so. And then in April, we expect to have another good month, plus we get our second installment of our property taxes.
And why do you expect April to be good?
I believe, I
Because
don't know,
of the
the census
census?
was not too bad the last time I checked.
yep,
What
it's
is
still
it?
the same. So right now our census is
I think you said 51.
It was 51 for
Yeah.
March,
49.
49.
And what's the estimated property tax? Is that like
Coming.
200,000?
No, the
Without-
April one is always lower than the
Yeah.
December one. The December one was about 190, 200. So this one should be about
80.
160, 170,
Oh, okay.
somewhere in that
Very
neighborhood.
small, we get, it's
But
3%.
you should get it today,
Is that
Monday.
my hearing aids?
No.
No,
Oh, is that what it is?
Because they
I
start
hear
beeping.
something.
I do
no,
too.
that's outside.
Somebody's out here.
Yeah, it's
Okay,
3%,
thank
it's
you.
3% of our budget.
I'm just curious about what the number was. Thank you.
Yeah. Okay.
We don't get enough in property taxes when you stop.
We do
making-
not. And I'm gonna share some other stuff with you guys.
Oh.
It's gonna
Okay, so-
take even more away.
Moving to page 19, or 13, excuse me, this is your Eden Valley summary. Once again, the top half is by department, and then the bottom half is by expenditure type.
Wow.
About 1,772,000 compared to 308,000 the year before. But look
I mean-
at your Medi-Cal and Medicare,
Can
that's
we just
where
stop
it is.
there a minute? I mean, just take this in a little bit. Because
Yeah,
when
geez.
I arrived here, Eden Valley was losing 600,000 a month. I
Yeah.
mean, it made me sick to my stomach. And just to see the progress that we've made, and the lift that we made, I mean, to see this is pretty awesome, so.
Yeah.
It
It's more than
really
awesome.
is.
It's
And,
more
you
than
know,
awesome.
Yeah.
This is another reason for a party, but come June 30th, you know, if these numbers keep up, this is,
Yeah.
the ship is turning, as
And
they say.
everybody's in tune to this,
Yeah.
so.
Is the clinic as good a shape?
We'll see next.
Okay.
Okay,
Turn
on
the page.
page 14.
Turn the page.
So, once again, the 705,000, we have already talked about this, but 705 includes a write-off of 1,125,000, whereas March of last year did not include that write-off. Okay, so
Oh, wow.
yeah, it's about a $600,000 swing. Okay, 625,000.
Good.
All right, and then you can see by month, Eden Valley profited 394,000. The clinic profited 50,000. The district-wide expenses are about 90,000, which is the average. And then you can see where I wrote off 375,000, the estimated PPS. That's where I wrote off that estimated. Okay,
Is that about what you do, $375 a month,
375 a quarter.
a quarter?
Yeah, and it's based on last year. Last year the total was 1,494,000. So this year we're estimating 1.5. It may be a little higher.
Uh-huh.
So there may be a little bit more, but I'm not too worried based on the numbers, how the numbers are right now.
Yeah.
It'll be a small adjustment compared to a $1.5 million adjustment that we had last year.
Is there a breakdown of what the reduction in what we're paying since Natividad's not coming here every day anymore and we're down there? That should be saving some money. Unfortunately, we're losing service.
We're actually
Are we
back on
coming?
track. We're back on track. Yeah, there was, you guys gotta understand, this is a rural health community, and it's difficult to find doctors.
Yeah.
Oh, yeah.
And especially OBGYN doctors. We're very fortunate what we have. So what they did is they added some additional nurse practitioners into their mix of folks. So they were averaging, gosh, I think we got down to 3 days a week, 2 days a week. We're now back up to 4 on average for that department. So during this time, things were down. Things are down at the clinic because people were gone on leaves and people were on vacation, and then on top of the providers. But it's back up again, so we're averaging more. I mean, the most you can get out of a provider in a month on average is 21 days of operation, so we're doing about 18. So we're about 3 days down. But it's gotten a lot.
But that means, so we weren't paying the full amount the last few months, and we're paying a little bit less than that 38,000 a month because they're not coming every day.
It's about $1,800 a day, and if they work half a day, they get half of that. If they don't work at all, they don't get any of that. So it goes hand in hand. Yeah, it goes.
It's
hand in
nice
hand.
to have that affiliation with Natividad.
Sure is. I mean, you're not going to get that type of level of care, especially in a rural health clinic. And we've been trying to find our own service provider, and the cost is more than double.
Well,
So we're getting it at a discount, and we're getting doctors.
And not only that, but Natividad, you've got a resource at Natividad, which is excellent. And then Natividad resources with UC San Francisco. So there is even additional resources available to the providers and connections,
Yeah.
And that's invaluable. It really is, because all it takes is one complicated patient that they need those resources.
To try to keep a personal contact out of this, we have a nurse practitioner here that's been doing OB for 35 years that sits in the corner of the clinic here, isn't even in the women's center very often, but sees most of the sick care for the women's clinic. Is there a reason why that couldn't be more effective? She's here every day, but sits in the corner of the clinic instead of in the women's clinic, and we have days when there's nobody there.
It's just creating the balance of the operation, because right now our need is in healthcare, everyday healthcare.
Yeah.
That's where our demand is. We can't keep it up. And CCAH wants us to open our gates again and let people in. You guys got to remember, they see over 4,000 patients a year in CCAH. Visit counts is about 200 a day. We're roughly about 33,000 right now. At our peak at 2020, we're about 40,000. So that's really desperately where our need is, and taking somebody away, like you mentioned, from just a daily operation, I think would even be more detrimental to those that need daily care. So it's definitely an art, and it's a balancing game. I wish I can just say, yeah, let's move somebody over and it just will fix everything else. But what it'll do is it'll crutch this place in order to lift this place. So I have to kind of create a balance.
Well, and if there's no patients for her, if there's no patients that come in,
yeah.
then you gotta meet the needs of the public, and that's where the needs are.
And that's where the needs are. I mean, I think eventually into the future, I think that can be ideal as we can find replacements and substitutes. But right now, I don't have any replacements or substitutes. I have what I have, and their schedules are busy. And remember, right now we're at the start of our agricultural season again. So people have just come back, and there's a lot of sick people with flus and So, yeah, that's my only thought process. It sounds as simple, but it's complex. But we don't discount anybody's talents. We definitely use them as the best as we can as our abilities.
Okay. So, and then on page 15 is your cash flows. You can see the 1.1 million being added. Loan proceeds, first capital, the 1.1 million. And then, just so you understand what this page shows, that increase in third-party settlement means that we booked an expense, but we haven't paid it yet. So that's why our cash is higher. Okay? All right. So that is the financial report.
Any questions on this before we get Mac's questions on the budget committee? Okay, so
Thank you.
can we have a motion to accept that report?
I make a motion.
Okay, do we have a second?
A second,
Okay, roll call?
Graig,
Yes.
Rosemary,
yes?
and
Yes.
Max.
Yes.
Okay, Mac, questions?
So, well, the question was talking about there was no board package for that, so there's no data to review. Our bylaws say that the agenda and the board package would come out ahead of time. So obviously there was data review, but there was no package to review. So
Actually, we didn't bring anything because Brent, the financials weren't ready. So the financials that we had available were just February's.
okay.
So that was why.
And how about the proposed budget? Was there no proposed budget
Not
talked
yet.
about? Okay,
It-
because that was an item we were supposed to be discussing.
It was a preliminary meeting where we began to discuss what we were going to be putting in the budget for this current year.
Okay. What does it take to get that breakdown we've been talking about of those sub-accounts, even if it's a 150-page digital report, to look at those numbers so we can evaluate that? We could sit at a table and talk, but we need to look at those numbers to generate questions to ask. What does it take to do that?
So we discussed the numbers. They're working on a few minor adjustments to the salaries schedule, which is 70% of our current budget. And once I get those, then we can start putting those in. So that's where we're at.
I mean, just to see where we're at right now, the sub-accounts, and look at these things like it breaks out that nativity. If we can't look at those numbers, how can we say, oh, here's some areas we need to ask questions about? And it's so we can ask questions. Because without seeing those numbers, it's like, wow, this looks pretty, but without that breakdown, how do we ask questions? That's what I'm asking
Yeah.
for. And
So
even if
at
it's an
this point,
electronic
it's not
report.
at this point, it's not at that stage. So we're working to get to that stage where you can have those numbers.
Well, we have this report, and if our regular monthly report breaking down by month, to break that down into sub-accounts so we can look at the little pieces over the last 9 months would be some data to look at. And granted, that's a big pile. I know the city gives out a binder to each council member with breakdowns of each department and their budget in that detail so they can look at that detail and ask hard questions about that. It's kind of hard to ask questions about $900,000 or $5.7 million because, wow, that's a lot of number, but those breakdowns is what we can look at. And it is a big pile. I'd like to see it electronically to look through and formulate questions to ask, because I don't know what to ask because that's just big numbers.
Okay.
I mean, the budget breakdown primarily right now was informational basis. We still haven't divulged or gotten into those details. So once we get into those details, then maybe we can, our next budget meeting is in June, so maybe we can.
May. We have one.
June 6th, well, June 6th is what it says on our schedule.
Oh, okay.
Yeah,
Okay.
June, but we'll have to have we'll have a draft preliminary when it comes here
Right.
in May.
So we can't take the current finance report and expand that to show sub-accounts for what our budget was and where we are right now. When we did the budget, I never saw a breakdown when we approved the last budget. It was all these big numbers there. Never saw a report digitally or on paper that said, this is our breakdown for that budget. And talking about salaries, I've never seen our salary policy. I'm not talking about approving it, but just to see. Because you should, I'm assuming, have a policy that says, for these employees, here's the range that I can use. And we should approve that. I've never seen that. I have no idea what those ranges are that we're looking at. And that goes back to that other question that I was trying to ask without tasking is, I'm sure you have a staffing guide that says, I need this many nurse practitioners, this many physicians, this many MAs, this many admin people, and there should be a guide someplace that talks about what you need, and that goes into the budget. I've never seen those numbers of what you're working
So
for.
that's the information that we were sharing at the last meeting.
Okay, then why
Yeah.
can't we print that out and hand it to somebody?
Because it wasn't complete.
Okay,
Yeah,
well,
we're
they're
not-
working-
well, where's the numbers from what we used last year to plan? I've never seen last year. So you had to have a plan. There's got to be someplace written down, this is our staffing projection. And if you don't have that to plan the budget, how do we plan the last budget that we approved? I've never seen those. That's what I'm asking for. There's got to exist someplace. Or maybe it doesn't exist. I'll calm down. It's
Yeah.
long, I'm tired.
So we can
But-
see it in June, we'll have more of a concrete, we're gonna have a draft, and then we'll have more of a concrete in June at the staff meeting when you come. So
Okay,
you'll be, not the staff meeting, the finance meeting when you come.
so what you're saying is, right now, you don't have someplace a document says, this is my salary ranges I can work with, and this is the employee projections of what employees I need to run the clinic. You don't have that. I'm not
I'm
talking
not
making for the
saying that.
budget. Well, that's what I'm asking for.
No, we
Why
have
can't
some-
we see that?
It's not complete.
Where's the last one you had?
Okay, that's complete, and if you want to see it, we can.
I've been asking for those things, and last time I asked for that, you said, hey, you're tasking me. Well, I just want to see that data. And then the answer is, well, you can't task people.
What to produce to.
Didn't we discuss this before and just go into the office and then?
Well, but go into the office, yes, but if it exists, let me see the paper or email it. If it doesn't exist, then you go in the office and have to explain. But it ought to exist. How do you plan a budget if you don't have those employee projections of need and you've got those salary ranges someplace? Well, where are those salary ranges?
You've got that from last year.
Well, yeah.
They have to exist.
It's based on the
Charisma-
previous years
Charisma
too.
and you worked on those, and so we have them. That's what the budget was based on. So, but I'm sorry, but I thought you were anticipating working on the current year.
Well,
budget.
I
So
am,
we're
but I've been
working-
asking for a year to see those kind of things to evaluate the budget and our finances. And these numbers are good, and I can come in the office, but I'd
So-
like to look at the
so-
data.
You want to see the detail.
So
Yes.
which is fine, because at the meeting, we did dive into that a little bit more.
Okay.
There's nothing in print because we just haven't finalized anything.
It doesn't have to be finalized to print it. You've got a rough, you got
We will
it
do
there.
another draft like this. We'll bring it to the board because we just have to have that to start those discussions happening. It's no approval, it's a draft. And then in our June meeting, because we have to bring the final one at the June board meeting, at the finance meeting, then we can go into more deep detail with you.
But
Can you?
And
going
we
into
should have
detail,
something.
but if you can't show me a document or send me those 150 pages to look through, then who has that? I mean, how do you put together a budget if you don't look at that detail?
We'll be able to show you more details by then.
But you've never been able to show me that detail for a
Can I
year and a
say
half.
She said she would.
I'm not done yet.
I'm gonna try to solve the problem. Brent, can you send Max the stuff from last year?
Yeah, the salaries and those type of things I can send, yes.
Thank you.
Thank you.
Okay. Okay. Any other questions, Max? Okay.
That's it for now. That's
You
what
just
I'm,
want salaries? You wanna know people's salary? You know you can't get.
I can look at any salaries. I can't approve her salary. I'm looking at the ranges. What are your ranges? I don't care what they're getting. You've got a range that says this is the range I can work with. You've got the authority to go up to this point kind of thing, and we're making the budget. And you've got staffing levels of what your projection are, I'm assuming. That's what I'm looking to see. What are those projections? We've never seen that here.
You'll get that to him, and then when we get the next, especially the salary stuff that's coming that Charisma's working on.
You know,
And
and
I
the
have
only thing
someone-
I wanna say is if we're doing salaries and stuff, it's gotta be kept, isn't salaries confidential?
So I won't be able to show
Names.
people's names.
Right, I don't care about names, but there's got to be ranges, and that's how you do the budget. You've got this much you can allocate, and that's the question.
So that document I don't think anywhere shows what the ranges are. It shows what people are going to be.
We can show allocations by positions.
Because
There you go.
we're supposed to have a board policy of this is the salary range schedule that allows the CEO to, within that range, give people raises and stuff within that range. There should be supposed to be a guide like that. There may not be, and that's the part of the question.
I understand that. I'm just saying that the document that I saw, that's what I'm trying to, so,
That's a great start.
okay. Thank you. Now, we got the treasurer's report,
Yeah, we did.
and now the monthly budget report, which is, you went through.
The budget report I have not reported on.
Okay,
That's
I'm sorry.
Starting on page 16.
Okay. I'm sorry.
Okay.
Go ahead.
So this is the budget to actual summary. Okay, our budget is in the first column on page 16 is your 9-month budget, total budget year to date. So that's 9 months. At this point, the budget showed that we should make a profit of about $75,000. That's that last line in the first column. Our total actual year to date for combining all three, the Eden Valley, the clinic, and the district-wide expenditures, we are at $408,000.
Question?
Where's
Does that 1.1 million loan balance fall into that at all, or is that
Yes.
subtract? So
No,
that's,
That
okay.
is included in here.
Okay, thank you.
Okay. So, you have your Eden Valley, which is the 1.17, okay? Now, if you go back to the other reports, it was 1.772, 1,772,000, I believe, was the profit. And it's 1.171 here because what we've done here, about 2/3 of the way down, you'll see under general and administrative, you'll see allocation of district expenditures.
Uh-huh.
That's the $1 million of district-wide expenditures that we're allocating 60% to Eden Valley and 40% to the clinic. So that's why that number, instead of 1.77, is 1.171. Okay? Does everybody understand that, or is that just over your head? I just want to make sure you understand that that's what we're doing here, is we're allocating the district-wide expenditures, a portion to Eden Valley and a portion to the clinic.
And it's 60-40,
It's a 60-40 split based on
60
salaries.
Eden Valley, 40 to,
Clinic.
which makes sense, okay.
Okay. Historically, we are about 6% of salaries are Eden Valley and 40% are the clinic. So that's what we've used. The auditors have always found it fair.
That makes sense, thank you.
Okay. Page 17 is your Eden Valley. It shows our budget through 9 months should be $883,800. The first column is a year. That's our total annual budget. And then I break it down for 9 months. So we should be at $883,800 for the 9 months based on our budgeted figures, and we are at $1,171,000. Okay, so we're $287,000 better at Eden Valley. And there are some swings here and there, primarily in professional fees, okay, which are some of our traveling nurses and things.
Yep, we're getting it down.
Yep. Okay, on page 18 is the same type of thing, and this is for the clinic. Our total annual budget, okay, the $1,000,005, that includes the PPS settlement. For 9 months, it should be $1,129,000, and we're at $1,106,000. So we're really close to the budget, our actuals for the
That was my
clinic.
question, is
Oh.
once we get close to that, so that it's, because there's changes that can be made if we need to swing it,
Yeah,
but we're close, so that's good.
Yeah, so we're already, this is through March,
Nine.
April, May, June.
yeah, so we're 9 months, so we got 3 months left.
Yeah, 3
And
months.
And a little
Yeah.
bit better than projected, which is a
Right.
positive.
Yeah.
Less negative. That's
Correct.
good, that's good.
Okay, and then on page 19 is our district-wide expenses. So if you look at the middle of the page, you can see our total district-wide expenses for 9 months. We budgeted to be about $1,033,000, and we're at $1,001,000. So we're $32,000 better in our budgeted expenditures for the district-wide expenses. Okay? So right there, Max, you asked the question a little bit earlier, in that second to last column, 9 months actual year to date, if you go down to property taxes, 213, 715, that's what we received in December.
Got it, and another 160 should come next month.
160, 170. I was thinking it was like 200, so maybe a little higher than that. Okay.
Good ballpark, and that's relative, thank you.
Okay. So that's your budget. So in total then, we're doing really well as far as our budgeting procedures to try to hit what we thought we were gonna do. And actually, we're doing really well. I mean, we're 408,000, but we did not budget close to 49,000 bed occupancy. I think we budgeted, if I remember right, it was close to 40.
Yeah, at the time, because that's where our numbers stood.
Yeah. So that is primarily the difference, is
3 months
the
to
additional
go.
8
3
beds.
months to go.
Yep.
So I do want to, if I may, add a little bit more to Brent's report. Because this month, we had to make some adjustments. One was some equity, and you guys know we've done this in the past, some equity adjustments. We did them for CNAs back a year or two ago. So we did the same thing for MAs. And what that means is that we looked at our scales to see where they would lie. We redid our scales and did notice the gaps between their salaries and those salaries on the scale. Unfortunately, we're not able to give them the full amount due to them based on the scales because it's just such a significant swing. But we were able to make some adjustments to them to the tune of roughly $12,000 to us in cost. So it was roughly about 5 medical assistants, focusing on those tenured ones with the organization so that they are more in line. We couldn't bring them to total equity because it would have been too significant. So we did bring them, we try to do somewhere about halfway to where that they should be and not the full equity. So that is already an added cost.
An added $12,000 a year?
Mm-hmm.
Okay.
And are they participating in the retirement and that type of thing?
There's only, it's been a while that I checked, but I think we get like 50, if not that participate.
Really? Yeah.
It's really your higher end positions that do more of the participating than your lower end positions. Mm-hmm.
Okay.
So that's already a cost that we'll have to incur because once you include an increase in salaries, as easy as it may sound, it's not that easy because everything else goes up. Their PTO goes up. All the rates go up, so it is a costly endeavor back to the district of how much it costs. Okay. Secondly, you guys were made aware of this a while back. If you guys remember, SB 525. This was a bill, a healthcare bill that the governor signed in October, taking the minimum wage and increasing it. Well, that bill was passed earlier this year, and it's supposed to take effect in June. But here's the thing: there was one that kind of went similar, and it was a restaurant one, and what he did at the end is that he cut out certain pieces and segments.
He sure did.
Okay,
He sure did.
so
Just
the-
bake your bread.
so what I'm hearing right now is that he's gonna cut out medical clinics, which means that it would only include like skilled nursing. That's really their focus, is with the skilled nursing side in healthcare. So I wanted to give you guys just an insight point of view. I've included everybody on the list, including medical assistants from the clinic and those that need it. So it's the whole gamut. What we're reading right now is that we're gonna be required to go up to $21 in our budget. We last year budgeted for $18 an hour increase. The increase is looking like it's gonna be $21 from all of our reading and contacts that we have.
If we're not exempted by the governor's action.
Only for the clinic. Eden Valley will not be exempted.
Okay, so Eden Valley definitely will. Okay, got it.
It's, and this is with everybody included, it's gonna cost us $325,000. That's equivalent to about $28,000 a month. And that's money that we are not, it's gonna come out of our general fund. So it's gonna be, although I think we'll be okay in our budget, but we still have to,
But this starts June of
First.
24,
June 1st
right?
2 months.
So, yeah, so then it will affect 1 month
of this quarter.
of this year,
fiscal.
and then we can budget for that for 2024, 25.
It's just gonna cost
And how
us
much was it a month, you figured out?
about $28,000. It'll be
And that wasn't budgeted in, so we'll have to budget
Well,
that in.
you said we budgeted $18 and this is gonna be $3 higher, so we budgeted but not as much as it looks like it's gonna be is what you just said, right?
Yeah.
Right.
Okay.
So there's some in the budget, but not the whole thing. So I just want to make you guys aware of that, that's going to be a play in the budget as far as what we're wanting to include in the budget numbers.
That projected $325,000 is if you have to make the raise across the board or only at Eden Valley?
Across the board.
Okay, and okay, that's across the board, but there's a good possibility the governor's gonna not make us do it at the clinic.
And it's only going to save us $8,000.
Oh, gee. I could be mad.
Doesn't help us. We still have to pay the bill.
Plus, obviously, we don't have money to throw around, but that means if you give a raise over here and there's.
That's
you
exactly
gotta-
right.
And if you're only talking $8,000, we'd have to consider how do we do that, because you gotta keep everybody happy because they're coworkers even though they're
That's right.
not. So that's something that has to be
So
factored
when we
in.
did the equity agreement or the equity increase, we were transparent with everybody, informing them that this was going to happen, but also explained to them that this was being given to their colleagues that were on the lower spectrum, and trying to kind of make it equal to what the existing colleagues are getting. So they were well aware that this wasn't across the board, and it's still the case on this one. We've been transparent when we
Right.
meet with the staff and informing them, because they came to us originally in January, oh, we read so-and-so and we're gonna get a raise. Well, not exactly, it doesn't work that way. So we had to educate, and we want them to learn on their own. And so ultimately, we won't find out till May 31st, if it's even,
Oh,
yeah. So we won't even find out till the day before.
Oh, wow.
Yeah,
Now, what you're saying, if I'm hearing you, is the employees that already make 21 aren't gonna get a pay raise.
Correct.
We just have to raise those below that to that point.
Right.
correct.
Okay, it's understanding.
And you know what, that's where you get the government playing employer.
They put us on the spot.
Marxism. Next.
What, I don't care, if they wanna raise that to 21, that's fine, but they then say, what are we we're gonna have to raise Medi-Cal.
Exactly.
Yes.
You know, and
Exactly.
And then they don't wanna talk about
Yeah,
that with us.
so, if, I don't mind them.
And property tax,
Right.
same whole thing.
Yeah, but
You know?
property taxes of
Well,
only issue.
but even just taking a little bit more of the property tax money, but you're absolutely right.
Yeah.
They're gonna raise that, and sooner or later, they gotta, Medi-Cal has to catch
Anyway,
up.
that's my complaint.
Well, that's what we
I've
told
voiced it.
Joe when
Oh.
she was here, but she
So
didn't have
that's
anything
the-
to do with
that's
that
the
anyway.
information.
And okay, so we're finished with the monthly budget review. Do we
We
have,
let that program go.
yeah, let him get out of here. Okay, do we have a motion on the floor?
I make a motion to.
Okay, to approve it, do we have a second?
Second.
Okay, roll call, Sophie?
Greg,
Yes.
Rosemary,
Yeah, yes.
Ann, yep, and Max.
Yes.
Okay. Conflict of interest code.
Oh, jeez.
All right,
Oh, jeez.
so in your package, you guys see that
Watch
big?
on Rosemary.
Oh, man.
I hope you guys read all that. Thank you
Oh,
so much,
yeah.
Brent.
Thank you.
Thank you,
Brett.
Brad. Take some popcorn.
I'm good.
So there's a
Sophia,
few things going on. It's a
contact
full
you.
packet of stuff, right? But it's all the same thing. So your
Yeah,
notice of
yeah.
intention, your resolution, your staff report, your conflicts of interest code, and current regulation. There's be parts that you guys will approve and parts that will get sent to the county so that they can review and approve and update. So anybody going, for example, when you guys go to renew your
700
Form.
not your 700, but also for your upcoming elections, you're gonna see the new one, is what it is. So this will also go through LAFCO, and they'll see it, and that way we can adopt it. So you should have read your notice of intention. The resolution is what we need adopted today. She included a staff report, and then the actual code and the current regulation.
So we don't get to change parts of this anyway.
It went through our attorneys and it went through the experts. I mean, but certainly you guys can. It just would have to go back to the attorneys and the experts.
Yeah.
Okay. Any questions? Okay. Motion to approve.
My question is, who wants to read all this?
I know,
That's
I
my
had a
question.
You did, I know you did.
Yeah,
I
I mean, it's very thorough and it follows
It
the
is.
law. It follows the law that's already made
That's it.
in the
yeah.
books. It's not, and that's what that last document is, just a copy of the law for you to reference.
Yeah.
Okay, so I'll entertain a motion to approve resolution number 2024-03.
I'll make a motion to approve it.
Do we have a second?
I'll second it.
Okay. Sophie, roll call?
Right.
Yes.
Rosemary,
Yes.
Ann,
Yes.
and Max.
No.
Okay.
You gonna change something, Max?
I just want to review. It's passed.
No,
Okay.
Okay,
It's passed.
staff report?
All right, that, the staff report is part of the resolution, so nothing more to add on any items 3, 4, and 5. That's actually.
Oh, I'm sorry.
I wanted just to reference it so that you guys can see their individual items, but that's just for information purpose. That's part of still the resolution,
Okay.
conflict of interest.
So then just left the next.
Yeah. All right, everyone. So Greg and I had the opportunity to meet with Darren and Kate McKenna. And thank you, Adriana. Adriana did a beautiful presentation. She created a beautiful PowerPoint for us. I mean, all in all, I have to give kudos to us and our team. They were very impressed by our presentation. They even said that they're going to utilize our method for the next one. So what we did is we gave them, they had 2 or 3 questions, and I included basically like a staff report to answer their questions so that they got good answers. So because a lot of this information, they'll utilize it into our MSR report. And so we provided that information to them. You know, we did stress that there is other special districts in our community, right? There is a swimming pool and there's a cemetery. We didn't want them to be grouped in with those organizations because we're so unique, number one, and number two, they have their own pain points. Like the cemetery district just doesn't have any leadership. I mean,
They're so far out of compliance, it's not worth talking about.
it just a lot. And so they agreed that they're going to highlight us all together, except we're going to have our own, you know, parts within the report.
No. Last
So-
time they did it separate too. This is the
Yeah, and
2012.
that's what I told them.
It was
And-
completely separate in
Yeah.
2012.
I guess they didn't want to answer my question. I kind of did say, is it resources? Like, why aren't you guys doing it? But I don't think they have very many people that work with them.
Initially, they said, the thought process is maybe there's a way we could share resources so that the cemetery district could be helped out. I could not figure out how the heck that our healthcare district could help them out. And I'm not sure there's any way the recreation district could help them
You
out.
just put them under the city council, let them, that's their job to help out if they're not
Anyway,
functioning.
but that was
Yes.
the initial conversation 1,004 years ago when this was brought up initially because we're not even, this is not part of their work program. They added to the work program because of specific problems with the cemetery district.
Yeah. So we met with them, we gave them our presentation, answered any questions that they had. We just recently did a follow-up, Greg and I, and this is just identifying our footprint. So one of the requests many years ago by board members was to establish our footprint.
The larger sphere of influence.
The larger sphere of influence. So they worked with us in designing that right now. And so what they design it and base it on school districts. So basically we will have
What we're asking for.
is our footprint to be incorporated into all South County. So whatever South
From
County.
Chular south.
To south to Greenfield?
So instead of just being the city of Soledad, it would be Chular all the way
South.
to King City. Well,
Yeah.
the county border, basically.
Yeah.
Actually, it goes to Kalinga, because Kalinga is part of this school district of this
That
county.
would be our sphere of
What's I
influence.
mean? It's out,
Yeah.
right.
We get property tax on that?
No,
No.
they would have to vote for that. But the reason is, that's what the SVMH has got. So they are one step closer to annexing us. So if we now say that's our sphere of influence, now we're on the same playing field. Plus, SVMH has not done any service south of Gonzales. Ida and her crew have done service as far as King City, and so we have demonstrated something that SVMH has not.
Except their stupid mobile clinics that they bring. But that's an encroachment
But
almost.
that's part of, and
That's part of the motion,
And that's-
motive, I'm sorry.
and that's part of the budget. We included at least $50,000 if we can. I don't know. We're playing with the budget.
For a mobile clinic.
And there are probably grants out there. That's a lot of work.
Correct. But right now, we want to just at least include in our budget if we can do it. We don't know yet. So that's the goal. The goal is to establish a mobile clinic, and if we can, then that will take us to be able to set up in the school districts and set up clinics there. So the possibilities are endless. So I just wanted to give you guys an update. Our MSR report is going well. We will have a draft review. They will send it to us so that we can review it. And we're just waiting for them. We should get it by the next month, by the next board meeting, we'll have the MSR.
And is everyone okay with, that's what Ida and I suggested to Darren, that we expanded, and those are the reasons why. Is everyone okay with that? Mm-hmm. Okay. I mean, that was kind of an informal, we don't need a motion, but I want to make sure that we're not, because we've talked about this before. I just want to make sure that we're still on the same.
Can I throw a concept out there just so it's there? Mobile clinics. The best way is having that self-contained van.
Yeah.
Yeah.
Way back when you and I were little, MASH. So they were tents. It's not as good as having a self-contained van, but you can have a nice covered trailer that you could set up in a office space that's not as good as that van, but it's way less expensive to get started. So there are ways to do mobile without having the RV, even though the RV is better. So there might be a way to start mobile without the RV.
There's a lot of used mobile clinics that are out there.
Greg found it.
And we're looking, because everybody and their dog bought one for COVID. And so I looked on, and we're looking at maybe a 2 exam room because of size, and it could even be parked out here and being added to exam rooms when it's not going elsewhere.
That's what SVMH has. I get my shots there every couple of weeks, and they've got 2 exam rooms and a little center area, and that's what they've got in their RV.
Yeah, well, this
And
is,
that's
the one
pretty
I saw is
functional.
much smaller, but yes, that's the
Wow,
idea.
they're building a new one. They're building one from Natividad, $1 million. Oh yeah, because they called me and they wanted me to consult. $1 million. I'm like,
SVMH needs to build a new one so we can buy their old one, because it looks pretty functional.
Yeah,
Anyway, thank you.
okay.
okay. So I'll go back to my report.
I'm sorry.
No, that was the top of my report, so that's perfect. So before, I hope everyone enjoyed their Easter. I hope everyone are enjoying the warmer days. It looks beautiful outside with the flowers blooming. If not, go to our garden and you'll see that. I want to thank those, let's see. Okay, we talked about the LAFCO already, in that regard. Leadership Academy is still growing strong. Our Leadership Academy was March 16th with the topic of building trust. This next academy will be focusing on managing performance, so that will be happening in the month of April. What else? CSCA. So Greg and I attended the quarterly meeting of the Monterey County, California Special District Association, April 17th. They talked about new initiatives, the new initiative 1935, and I'm not about to go into this completely with you guys, but I do want to make you aware. So here's a packet for each one of you. They will come and present if you guys would like next month, and this is a CSDA. Schell is her name, and she is, her name is Schell, and she's the CSDA Public Affairs Coordinator. She's offered to come next month. But just in a nutshell, this is a new initiative that, if adopted, will severely strike rules for raising taxes, fees, and assessment on other charges. And the way that I took it, and I don't know what you, Greg, so basically, you know how when you charge for a vaccine and we charge a fee for administration, they now want to control and say how much we can charge.
Who wants to control it?
It's so this group, it's an attorney firm out of Sacramento, who what they do is go around just suing, right? So this is them suing, and then they're trying to get people to agree to this, and if what CSCA is trying to do is make us aware, because if this were to happen, it can jeopardize how we charge fees.
Well, I guess so.
It can it jeopardize any raising of taxes or fees or assessments.
So this group is proposing a ballot measure which would make it a law. That's how they're going to control it.
Oh, gee.
But they're introducing it to make it a law. That's what they're. That's
But so they want.
You know, but doesn't the state of California, with like Central Coast Alliance, they set the fees? They set the fees for office visits, they set the fees for reimbursement.
Of what they give us, but not, they don't set our fees. So we charge our own administration fees.
Well, oh, you're talking to Central Coast Alliance?
Correct. So they give us, there's so much that they will pay for it, but we include our fees, so, you know.
But do they pay you for those fees?
They will pay up to a certain amount, and then the rest will go back in the form of co-pays or charges back to the customer.
So, because the reason I think, so that I'm clear on this, is if you bill for an office visit, say it's $50, and then you add on an
Say
administrative
another
fee.
$50.
Huh?
Say another $50.
$50. So now you've billed Central Coast Alliance $100.
And they only pay you the first 50 probably, let's say.
Probably the first 50, because they set the fees of what they will reimburse you with an office visit. And so where does this come into play? That because
So
if you're not going to
any of your private and your HMOs, like we can charge your other insurances, the admin fees. And we did that during
but you can
COVID.
charge those fees, but it doesn't mean you're going to collect.
Correct.
But we can still charge the fees, and those private insurances may pay us. And what this is saying is that even if they won't allow us to even charge the upsell anymore. They
So
want to control it.
instead of 100, they'll only allow us to charge 25 more, maybe.
Maybe.
Is what they're trying to dictate what we can charge, not what we'll collect.
My memory is, and this
And it
is,
doesn't do any good if you ask for it and they don't pay for what they're asking for.
Yeah.
But sometimes you'll get it though. Sometimes.
my memory, and pardon me, but my memory is they were going to, if you wanted to raise fees or change fees, it would have to go to a vote of the people, and it would be a 60%.
Yeah.
So
Is that what it is?
So it's making it far more difficult to do anything. So if, for example, if we wanted to raise property tax, it made it more difficult.
That I get, but
That
when
would
you
make it
go-
more difficult.
But when you're dealing with, the raising the
groups.
fees of office visits, or even here at Eden Valley with, daily rates, are you saying that this would inhibit us from changing the daily rates? But what happens when Medicare says, we're gonna increase the daily rate?
But see, that's when you have these initiatives that don't.
They can do that, but they won't allow the business to do that.
But
So
if
they're controlling our fees.
Medicare says you can change your daily rate, okay, they say, we're gonna reimburse you $300 a day and we're only charging $290. Can we change our rate to 300 or does it have to go to a vote?
See, that's the interesting thing, because you now have a federal
Exactly.
law and interfering with the state
Uh-huh.
law. Quien sabe? You look in the court.
So
And this is what they're saying. This is going to be the lawyers are going to make book on this.
Well, and this goes back to what I said to earlier, is the government trying to run your business.
Yeah.
Yeah. Well, this is not the government.
This is
This
just
is an
attorneys.
initiative coming out of a business group.
Yeah.
Which is trying to get the government to settle.
Yeah.
Exactly.
Because if they get a ballot measure and it passes, it now becomes all government law.
So one of the things we have to make, we don't have to decide. That's not what. One of the things we can decide is to oppose this formally. So that's something that we may want to consider.
So I give you the resolution, and I can put it in the next month's packet. So at least you guys have an option to approve it. And then we can have the representative from CSDA come and talk, who knows more about this than I
And
do.
I'm sure CSEA is going to oppose it, so
That's
we
who
wouldn't
wrote
have
it.
to do it ourselves, but using their propaganda to help share that so people know to vote against it is
Yeah.
the key.
Yeah, CSEA is asking us to support it so that they can have multiple jurisdictions supporting this.
Okay, maybe this is medical. We stayed at a hotel down south in Cambria. They had 6 different fees added to our room,
Oh,
you
yeah.
know?
Different
Man.
counties, different cities do that, that's their
Whoa.
So
income.
that's exactly what they're trying to talk
Yeah.
about.
Yeah.
So
Just
if,
a
so
list
do
of
you
them.
guys want me to, you guys want to know more about this and maybe
Oh,
include it
yeah,
in the
we need more
resolution?
information.
Okay.
Howard Jarvis are contributing it for this.
Who is?
Howard Jarvis, Taxpayers Association.
Is
It's fighting it, no,
fighting
they're
it.
fighting it, right?
No, they're in
They're
support of it.
of it.
Oh,
Oh,
they are?
wow.
Yeah, Howard Jarvis Taxpayers
Oh, I'm
Association.
surprised.
Oh, yeah, that does make sense. That does make sense. They're about reducing taxes and fees,
general.
and this is to reduce fees. So it's
And
maybe
make
not
it
good for
more-
us, but that's why they support it. Not that I like them, but
Yeah.
that's what
to
they
make-
support.
To make it more difficult to increase fees or taxes.
Yes.
Well, I like them.
Well, I like them in a lot of ways too, but in this particular case, this may not be a
It
good
could
We
thing.
need more information.
Yeah, okay, so what I'm hearing is invite her then to come.
That'd be wonderful.
And I'll put the resolution, and if you guys don't vote it, then you don't vote it, but at least you guys acknowledge, okay? All right, wonderful. The next thing, I signed up to go to a Monterey County Bay Area active attacker tabletop exercise. It brought over 30 agencies from our county, including Department of Emergency Management, Police, Fire, 911, cities, hospitals, and skilled nursing. This was a very eye-opening for me, not having gone to one before. It was an all-day event. I got to meet a lot of people within our community and within our circle. And I'll share a little bit more. I did share this with already with Greg, and I can share this with you guys, but this was their tabletop. And so we did a tabletop exercise. And the first exercise was if there was a shooter, an active shooter at the Monterey Bay Aquarium. So we talked about that. They go in the weather, the location, where it's happening. So they really break it down. The second was including that the individuals that were in attendance were Chinese who didn't understand the language, so they talked about that and what the challenges would be. So we got to meet with all, the fire departments, all of them, all the police departments where they're representing. All South County cities were Gonzales was there, Greenfield was there, police department. And then they did a second scenario, which was a family reunification center is set up at Monterey Peninsula College, almost 24 children separated from their parents. So they talked about, you know, how they would come up in recovery. So they go over each one of these steps.
It would be each phase of that one incident. So you had all these children who got separated with parents, they're rounded up, they're taken to a reunification center. So this is the initial response. Then the second thing is, what are the communication problems they might have encountered? How do you fix those? And then this is the tracking where patients are going to which hospitals, all those kinds of issues that first responders are responsible to through the mass casualty plan.
Very
So,
positive.
Learning the connections, you know, there was us, and then Carmel Hills was the other school. I got to meet them, introduce myself. The hospitals were there, got to connect with those folks. So it was good. As a result of this and making connections there, I got invited by Daniel Gonzalez, Emergency Service Planner for the Department of Emergency Management for Monterey County. He has asked me to be a collaborator to help develop a resilience plan for disadvantaged communities in South County. This is called Local Roadmap to Community Resilience Project. So the initiative is, the purpose of this initiative is to develop a resilience plan for disadvantaged communities in South County, empowering local stakeholders and residents to improve collaboration and coordination, recognizing weaknesses and strengths to better prepare in disasters. Haven't that what we've been talking about?
So that's exactly what the police department, the school district, and we have been working on for 3 years. And so we're going to be meeting Tuesday, hopefully to continue that.
So it says we are still at the beginning stages of the work, but it would be great to have your input. So I will be participating, and that was through this, you know, being involved through here. They will actually have, this is going to go on a step further. It won't involve us. It'll be more slated for police and fire. They're going to have a active shooter response, and they're saying Selena's hot is what they're going to do for that.
We've been
Okay.
doing that in the schools finally, which is good. Actually,
Active shooter?
yes, taking the teachers, and then we recently had one where we actually involved the students in a walkthrough of what do you do when you're thinking, are you going to run or hide, and how you're going to hide, and they're actually walking through that stuff, which is good because now the students are thinking of how they would react when a bad situation
Right.
comes.
Oh,
We've
God.
been doing fire drills for years, but we've never done this until recently.
There was, back in the day when I was in high school, they did a full active shooter where people came in shooting guns and people scattered. But it's not done frequently. I don't know if you need to go that low, but the preparation. But we have such limited resources here that's why this community-wide emergency plan is so important.
Totally agree.
Okay, moving on. I gave you guys a report last month about the water backflow prevention that needs to be done. This was a letter we received from the city. And we got total estimate cost of $45,000 for that. I did reach out to our architects, and they were able to provide the following information.
Pineapple.
Pineapple, yeah, and popcorn. And then there's soup. If you, he says for the backflow for the clinic, he says we'll probably need a plumber or a civil engineer to assist.
Oh,
For the
wow.
bypass meter at the Women's Center, he says we'll probably need a plumber or a civil engineer to assist. For Eden Valley, he says, I'm sorry for the increased burden, but you will need the licensed plumber engineer to help with this and HCI application. So that means we have to, this is gonna be a very long, expensive project. We did get a second quote from another person, and it's gonna cost $25,377.29. But because we have to get all these folks involved and the engineers, we're gonna move forth with looking at having our architects kind of lead the charge on this, because they're more the experts in this than we are. And especially with HCI, because HCI is very complex. And if you miss one one point, and if you guys knew with the fire that, you know, the alarm thing that we had here that we had to fix, it can get delayed and more expensive. So just know that that's the route that we'll be taking to get this resolved.
So just to get, you said the first statement was the estimate about 43,000 and the second estimate was 24,000. That 43,000 doesn't include getting those engineers involved or including those, okay, so the engineering is, so we're probably talking $100,000 ballpark.
Once you get HCI involved, HCI is just,
Okay. Thank you.
You can see around town, there are many places, I want to say Valley Foods, I don't know what the name, you can see it being done there. There's several places where they're already starting to do that.
Yeah, because and it's mainly for Eden, because Eden is governed differently.
Right, thank you. That
This
answers
is
the
when
question.
you want a budget down the road for capital improvements and repairs.
So we need to do, I need to think about that out loud. I sit on the bond committee for the school district, and they have a kind of an expert come out. So I'm gonna talk to Howard about that, and maybe we have one of their kind of experts come out and do a full assessment of all of our property, and then give us a full report. I think that's gonna be a better solution. I mean, we can have our maintenance person do it, but the reality is they'll be able to, HCI, if we get their engineers, can structurally tell us,
The roof and
yeah,
whatever.
everything. So I think I'm gonna maybe take that approach. It's gonna cost us a little money to get the report, but at least you guys will know, moving on into budgets, what you'll need to do, okay? All right. So, and that's the update on that. Let's see.
Are you still talking about Eden Valley? Because I have a question.
Not yet, but we can ask Susan to come in for Eden Valley.
Oh, okay.
Is it sweet?
Mm-hmm. It's really good.
We already talked, so I just wanted to share with you guys that I was a presenter at Senior Awards Night for the Steve Pritt Memorial Scholarship and the Jack Franchoni Scholarship. There was 2 young ladies selected, and they came into the foundation today. Just very smart, brilliant young ladies. I'm really excited for our future. They get $1,000 from the foundation and another $1,000 from Rotary. So I participated in that.
So, so what's happening with Jack Franchoni's scholarship? Because
I'd eat it all.
Pritz, we've made money to continue it, but what about Jack's?
It's just the same. We'll do the same fundraising this year because we had the money from the Central Coast Credit Union.
Yeah.
We didn't have to worry too much about it, but we'll have to do a fundraiser for the next one.
Has anybody talked to Carlene?
She was aware of it. Yes, Rotary mentioned it and talked to her. What else? So we and I didn't bring this last month, but we got showcased. This was somebody who we met at the farmers market. It's a lavender farm out in Arroyo Seco. He actually featured us in his advertisement, and that's one of our patients' hands. So he featured us, and what it is a towelette filled with lavender, and it has a lot of remedies, and then he featured us in his brochure. So I did want to show you guys that we are, we have become partners with other folks to really showcase
Do
us.
they donate those, or do you have to buy them from
We
them?
bought them. We bought them this round. So just a little, good good filling stuff of things that we do.
Well, who's the name of the person, do you know?
Which person?
From Arroyo Seco that does this?
Oh yeah, it's his name's on the back.
I've driven by this.
Ryan Hopkins.
Ryan?
It's on
I
mine.
know where it is. It's on
Here.
Carmel Valley Road.
Oh, okay.
Here,
It's
Rosemary, you wanna
about,
write it
it's
down?
about,
vendor at the market.
Oh.
it's about 5 or 10 minutes up the road from the Y, from
Oh,
Gidget's
really?
house.
Okay.
Okay,
Not much to look at.
what else? Salinas Valley Chamber of Commerce. We were spotlighted
Oh, nice.
for our support of the HR 25. So the highlight is Soledad Community Healthcare District leadership applauds historic advancement for special districts nationwide. So we are a trailblazer when it comes to supporting special districts.
Nice.
Okay. All right. What else? Alliance on Aging. So we applied for several grants to support our expanding businesses and services and needs of our staffing needs. Alliance Medi-Cal Capacity Grant Program has 3 grants available. So we wrote 3 grants. One was chicken noodle, Rosemary.
Okay. I'm looking at everybody.
Chicken
In
noodle.
her report, chicken noodle.
An MA position, we applied for $65,000. A community health worker for $65,000, and a provider for $200,000. And these are new positions. They want you to hire new people.
And
So these are
applied
new
and you
grants.
haven't heard yet?
No?
No answer yet?
No, we just applied. We won't know till June. Yes, these are brand new grants.
Got it.
So-
65, 65, and 200?
65, 65, and 200.
Is it good?
Did you
Yes.
apply to that grant that the city had?
Yeah, but they took it back, remember? They
Did
first,
they?
yeah, and I haven't seen anything more on it.
Can I get you some, Rosemary?
Oh, could you?
Yes.
Thank you.
Capital improvements, we continue to do capital improvements, computer upgrades. Remember, we have the obsolete and kind of, so we just replaced another one. You guys see at the back of our packet, we want to always include what our members, our residents are saying about that. So in the back of a packet, dear all, thank you for all that you do in care of my mom, Nida. So beautiful things that are being given to us, and I want to make sure that we're including that and talking about those. So you will see that in the back of our packet.
That's nice.
We haven't opened the soda shop. We're still not done with all of our design. We're hoping that sometime in May we'll invite you guys all for the grand opening, so look out for that. Years of service, let me pull that out.
How's the soup?
It's hot.
It's good.
Hot.
But it is good. Prepare me for a long night. It'll be good.
Okay, so years of service, we have 1 year of service, which was Jay. Adriana showcased him already in your packet that you guys seen. He's a great guy. He's been here with us for a year. We did hire an RN on staff. I don't know if you guys are aware, but there is a new law that is being written. And thank you, Greg. He brought me the article as well. They are now requiring, because since COVID and all the fiasco that happened at some of these places, they want us to have 24-hour RN coverage, where in the past all you had to have is 8 hours.
Oh, really?
Oh, so you have to have an RN
Oh,
24
wow.
hours a day.
It's not here yet. It's going to take 5 years, 4 to 5 years before it gets that. And then they increase the number of hours that you have. I mean, right now they say for CNAs it's 2.4. Pardon me. They want it to go to 2.5 hours. It's 2.4. And then the all-around hours they want you to have is like 3 point something. So we're hitting those benchmarks. But once this goes into effect, it does change because RNs are very, very expensive. So just know that's another thing that we have to look down. So we just hired another RN, so in support of
Did you
that.
get a director of nurses yet?
Yeah, well, she's an interim.
Oh,
Yeah, we don't have a, so our director, and Susan would say our director of nursing who was here resigned. She went to another facility, so we've hired a new interim and we wish we can keep her. She's phenomenal, but she's a traveler right now. So we're looking for permanent. So hopefully she want to stay.
I was just going to say about that article, there's a place in Carmel Valley, I think, where is it?
Yeah.
Carmel
Yeah,
Valley?
this is sad. Pacific Road.
Oh, Pacific Grove is
It's
that's
closing.
owned by corporate, and they're being fined by the state because it was bought by a corporation, and then they cut back staffing to make more money, and now they're being fined by the state because they're just not providing adequate service.
You know, this business is very, fickle, and healthcare is very fickle. I mean, one little move you make this way is a huge impact, unlike any other types of businesses that I've managed. So you have to make them like slow pivots, and especially when you look at skilled nursing is too expensive, and it starts with the staffing. It's just so expensive. And then you got to think about all the medications, all of the equipment, everything has just gone up dramatically.
well,
So-
it's, keeping a close eye on it like you've done has really made a difference in the financial report.
Yeah, and I'm trying. Did you send her a note? Adriana, can you help us? Census right now is 49, 7 are Medicare, 4 are managed, 2 are private, 34 are Medi-Cal. We do have 1 bed hold and 1 on hospice. Our occupancy is, let me tell you, I didn't calculate that. It's not, that sounds too.
Good.
83% is our occupancy.
Right now?
51 out of 59, is that what you're saying?
Yeah.
I'll put the last number set here, 59, 51.
Okay, referrals. We've gotten referrals from Salinas Valley, 15, Natividad 2, and 1 from Stanford. Sounds like this should come.
How many from the Natividad?
2,
2. And 1 from
Stanford.
Stanford.
I hear Susan. Hear her footsteps.
That's good.
She's right behind. Okay, while we're waiting for Susan to come in, City of Soledad. So Eden Valley, we have had in the past for years, is a memorandum of understanding with the YMCA. As you guys know, the YMCA has changed hands and is now part of the city.
Oh, is that what it's part of?
Yes, it's a city community center. So what I'm asking for is for us to renew our MOU with the city of Soledad. And we now have a meeting about that because they are telling us that we don't need inclusivity, but I'm not asking for inclusivity. We are just asking for, in case of an emergency, to have access to that facility, right? So Greg and I are gonna go, you can chat more.
It's
about it.
more of a, it's going back to the community emergency response plan.
Yeah.
There are certain areas that the city should have MOUs with to make sure, so that if they wanted to use the high school gym or the multi at Gab or Santa, because if there's a major incident, like it's an earthquake and wires are down, there are only certain places you can get to. And so you need to have as many facilities open to you as you possibly can. So we're acting on that community response plan saying, we want an MOU with the city. The city should get an MOU with the school district for fuel supply because they have that above ground storage. The city uses gas stations other than PD has a above ground fuel tank there in behind the PD, and there's a 500 gallon above ground storage tank of diesel. But if you have an extended incident, that's not going to hold you. And so have as many, so that a logistic officer would have as many resources to draw from to supply everybody with the fuel they need.
This totally makes sense. So clarification, we had an MOU with the YMCA. The YMCA no longer exists because the city took over the community center. If that clarifies what the problem is. And so now there is no organization we have. So the MOU would be with the city to use the same facility that used to be run by the Y that's now run by the city. That does make sense.
And we did enter in it, from a correct, enter into an MOU with the school district for fuel, and that was the question I was asked by Chris, is this exclusive? And I said, no, it's not exclusive. This is one resource that the community could rely on. But if you had an emergency, you're not gonna be running school buses. I mean, that's,
You're right,
So
right.
the MOUs with the school buses.
How's the city to work with?
I don't know, we're gonna find out.
There's a lot of changes over there.
We're gonna find out on Tuesday.
yes.
Do they have a quorum and a council and everything now?
I think so.
Yes.
Did they swear in the new guy?
Yes.
The one
Couple-
gentleman, there's a gentleman
month ago.
that got inducted.
Oh, did they appoint somebody new?
No, Fernando got elected in the last special, in the March election.
Yeah.
So they now have 5 council, actually, they have 4 council members because Ben Jimenez resigned.
Yeah.
And so they got a vacancy.
So now they have a new vacancy, but there's 4 of them.
Are they gonna appoint somebody for that one?
Last I heard, they hadn't figured out what they're gonna do.
They should appoint the guy that ran against Fernando.
There's a lot of,
He's running for the
hard now.
Cardinal board now.
Yeah,
He
Good.
moved on.
yeah, I heard that.
Okay. Susan.
Well, good
We
evening,
got-
board members and Ida and our team here. Susan, in regards to our report for March here at Eden Valley, we had a strong March in regards to our census. Almost broke record for the entire year compared to last year's. Our census was at 51.57 in average occupancy. We had the highest number of Medicares so far for 2024 at 15, 32 Medi-Cals, and 4 HMOs. Referrals primarily came from Salinas Valley, which is 15, 2 from Natividad, and 1 from Stanford. Our wait list we currently have is 1. For California Department of Public Health reports, we did do 2 self-reports. One of them obviously was in regards to our flu outbreak that we had, and then another one was in regards to an elopement that occurred here in our facility. And right now, the elopement one is still currently pending, but our outbreak has been closed, and CDPH found no findings in regards to that. So that was really good news for us, that we're doing everything that we know and have been trained so hard in regards to any type of outbreaks. In regards to that outbreak that we did have 4 residents, excuse me, did I say flu? It was COVID. I apologize.
Oh, okay.
It was a COVID outbreak. We had 4 residents who had it, and then 3 staff. We finally got the Department of Public Health to clear it on April 10th. And again, there was no findings in regards to that COVID outbreak. It had actually was brought in from an outside person. So none of the staff actually got that. In regards to staffing here at our center, our Director of Nursing, Shanta Brown, had resigned, and we did find a interim DON. Her name is Josie Woodard. I don't know if you've been able to meet her, but she's a great nurse, has lots of knowledge, and has just continued to keep the nursing and the care team and the quality of the care of our residents strong and well. So we're really excited to keep her staying on board and continuing to support the clinical care team. As I don't know if you've already mentioned it, I'm probably sure you did with our board in regards to the new minimum wage for our healthcare. So we're making sure that our team are being very diligent and being very cognizant in regards to expenses and different things like that to help alleviate as much as possible in regards to the upcoming minimum wage rules. The next event that we had here at the health center was the government officials who came and visited the center, even during COVID. So it was a very nice invite, and having them here to see our community regardless. The next item that I have here is in regards to CDPH event. We received notification from CDPH in regards to 2 cases that occurred in 2023. The result is $25,000 due back to the state by April 25th. The internal investigation was launched. We immediately took action to correct that situation. The result was that a tenured nurse did not follow our internal as well as the license protocol while responding to an emergency code. That situation was very isolated. We knew the specific nurse, but after that, our plan of correction was to make sure that all of our staff are trained and everything has met to standards. And CDPH was really glad to see that, and they approved our plan of correction. So moving forward, we know exactly what the protocol is. We continue to do training and education in regards to that practice. Okay.
How many years had the tenured employee had her license?
At least for 5.
Yeah.
At least for 5.
Oh.
She was in Albion.
Yeah. The online report said they came in and found a patient unresponsive. He was cold, and nobody tried life support until they got the doctor, and that was.
Well, actually, the details is that the nurse was present, but she didn't call the code. She did the protocol, but she's an LVN.
Yeah.
She's not a nurse.
Right.
So
they don't have that authority.
Correct. Only they can announce that based upon the doctor's decision to make that call.
And the accountability is, for our sake, we held her accountable, and she's no longer with us. That she now still has to be accountable to the state, and who knows what they're doing.
Yeah. They'll discipline her.
They'll discipline her for her actions.
Yeah. So, but in regards to all of the other plan of corrections that we have still outstanding, every single one that has come back has been no deficiency. So, that's an ongoing effort that we continue to strive for here, is that, if there's incidents, we do a self-report and make sure that all of our protocols and practices that we've been doing have been practiced strong enough. So things happen, but we know what to do exactly
And
when those things
self-reporting
happen.
is so important.
Yes, yeah. Yes.
Yep.
You know, it's better to be transparent.
Yes, absolutely. And that's all the report that I have.
Thank you, Susan.
That's a lot.
She has a big day tomorrow. They're doing skills tomorrow.
Yes, we're doing our all-staff skills fair tomorrow, so.
Yeah.
Yep.
Any questions of Susan?
Thank
Nope.
you.
Thank you very much.
Thank you.
Thank you.
Very thorough.
Okay, just a couple more things on my end. So just going into lastly, the clinic. They're also receiving their annual review in the next month. So hopefully by the next meeting, if not the following meeting in June, you guys will be able to hear the update of the annual review that they're going through right now. So community events that we talked about already. Let's see, anything else I need to add? Oh, I attended the Ag Woman of the Year event, luncheon, along, and sat at the First Capital Bank table, and the winner was Kobe Pereira, and which is Joanne.
Her grandpa's
Williams.
here.
Yep, and her grandpa's here, so we took that page and the paper and laminated it for him.
Oh.
And then he said, can you text her and tell her that I'm so proud of her?
Oh.
So social, Pam did that for him. I mentioned already I presented at senior night and then senior apartments, and that is it. As always, thank you so much for your support and leadership, and that's my report.
Ida, how big was the turnout at the Ag Women's Day?
Oh, it was completely full.
Was it?
Yeah. New
Because
faces.
I didn't hear about it until it was.
New
super
faces,
good.
I've seen a lot of new faces that I hadn't seen because I've been going to that for years, so.
Okay.
And that concludes my report. Any questions or anything else?
One question. So we're due to go to trial in June on our lawsuit. That's
Which one?
the freedom of information at Sandoval. Last we talked, you said is that still going to trial in June?
As far as I know.
Are we going to have a closed session to go over and find out what all the things that we're arguing with them about disclosing?
I can talk to the attorneys.
Well, and we should know what it is that we're rebuttaling.
Yeah, I don't know. It's the attorneys that have been handling it.
All right, but the lawsuit says this is what they're complaining about, and we're not disclosing information. We should know what that information is that we're not disclosing.
Or what it is he said wasn't disclosed.
But, right, we saw some of it initially, but there was a couple examples, but there's several items that we're not disclosing,
I think
and that's what we're fighting. It'd be nice to know what it is that we're not disclosing, so we know what we're being sued over before it goes to suit, and if we lose.
Whatever we're being sued over is in the, if you read the
It's
document,
right here on
it's all
the-
right there.
But we don't all have the whole document. You showed it to
No,
us.
it's online.
It's online.
you
Monterey
want-
Superior Court of Monterey
Superior
County.
Court. You
Or
can-
I'll email and ask for the link, because I looked before, but I couldn't.
You didn't find it?
I found some stuff, but I couldn't find the whole document. All right,
Okay.
I'll email and ask if I can't find the document.
Email me and then I'll see if I can find it.
Thank you.
That's really in the nutshell, and outside of that.
I just was curious what it is that,
Okay.
that he's arguing about.
March, April, May, June, so I'll talk to the attorneys and see, cause I haven't heard anything
Right.
except, in the beginning, they provided information and they asked.
It'll
for
probably-
And
updated-
a couple of months ago, you said there's a June trial date, and that
It
was
is,
the
that's
last,
true.
that was the last update.
Yeah,
But
so that's
It'll
all.
that could
prob-
change and shift too.
I'm just kind of curious, has he ever lost, because this is his job. His job is to sue.
He's suing the city of Greenfield.
No, he doesn't lose.
He's
He's
sued
got a good lawyers.
Carmel.
He's got good lawyers.
He sued Carmel Unified School District.
I think he's the biggest one I believe is
Hartnell.
Greenfield, but he sued the president of Hartnell,
Uh-huh.
who was on the school board in Greenfield. That was his big one that I heard
Yeah,
about.
yeah, he did bad things for Hartnell.
Oh.
Uh-huh. Wonder if I were not here.
Yep. Unless there's any more business, we'll adjourn the meeting.
Okay,
I move we adjourn the meeting.
Thank you. Second?
second.
Okay.
Oh, and we meet again.
One last conversation is we need to make sure we set, or we can talk offline about the next finance meeting to make sure we're good on date and time. Now you said a date and time,
It's
but
set.
but as I said
Is it
before,
not working or-
3:30 doesn't work for me. 4 or 4:30 works for me. The last time I didn't think I could be there, and I thought I had it worked out, and I had to take kids, so I wasn't back in town till 7:30.
Are you retiring?
In the end of June, but not before the end of June. It's very hard for me to be here at 4 o'clock, let alone 3:30.
And the only reason I want to, the only reason
July,
that the time is there
June
is
30th
because
is my
staff
last day.
time.
July
So
is,
that's the only thought, you guys
Lawsuit
may have to
trial.
pay,
Oh,
not my
thank you.
staff time, but if other staff time, to be incorporated into the discussion, that's the only thought.
Okay,
Because there's certain documents that staff
Has-
will support us
with, you
with.
know,
Maybe we can at least push to 4 o'clock and I can sneak away, but it's very difficult, especially this time of year, because we're into year stuff and crazy. But I am retiring June 30th.
so do you want to try to shoot for 4 o'clock and see what, for this
Well, if
next?
he's retired, you could leave.
But I won't be retired until
Not that
July.
time.
Well, that's when the meeting is,
It's
July.
June 5th is the next meeting.
Oh, I thought it was
That's
July.
okay. I'm just reaching out.
So why don't we start it at 3, and then what time he shows up by 4, then we could just do a
Start at
recap.
Well, it's scheduled for 3:30.
Right.
All right.
What, 3, keep it at 3:30.
I'll make every effort to be here, but
By
if
the
I'm
time
late,
he
we need
gets
to,
there,
And then we'll just
we'll just
recap.
recap it.
that's fine.
That's fine.
Otherwise, we're gonna have to.
If you're good with that, I'm good with that, because you can't really technically do anything without two of us
No,
anyway,
we're
other
doing
than
it anyways.
have a discussion. Thank you.
Okay,